Hi, everyone. This is Kavita Kaul. I am from Richmond, Virginia. I'm a speech language pathologist and audiologist, and I specialize in auditory processing disorders.
And I'm Elizabeth D'Souza. I'm from Connecticut. I'm a speech pathologist and audiologist too. I specialize in auditory processing disorders. For today, we are going to be doing our third recording, and this is reviewing the article, the SSW series article, volume 1, number 5 of November 1979. The highlights of today's article is the effect of alcohol, prescription, and recreational drug use on auditory skills. And we will also be looking at the significance of left competing scores in reading disorder.
There are a number of studies listed in this article. The first set of studies were two pilot studies that assessed the influence of alcohol and prescription / recreational drugs on the auditory skills. And what they saw was the baseline SSW scores when they tested the auditory skills were normal when no drug or alcohol was ingested. And then as they steadily increased the amount of such recreational drug use like marijuana or alcohol, the scores, the error scores on the SSW test also increased. The increase was significant where the alcohol intake, as it increased, the errors doubled in the left ear scores compared to the right ear. This shows that there was a lot more effect of alcohol on the non-dominant side. Most probably these people were all right-handed people. And then it also showed that there was a residual effect of the SSW scores, even though they were all normal at the beginning. Even when they stopped taking the recreational drug like marijuana, there was a residual effect of it when they retested these people on the SSW test. Also, the other significant factor that we saw in this article was that the 8 cardinal numbers on the SSW score that you have, there was a cyclical effect. So the right ear scores were low, and then the left ear scores went up, and then again the right ear scores went down, and then the left ear scores went up. So that cyclical effect also was noticed, which again corroborates the left non-dominant side effect. And just from all of this, they thought that there was an anterior dysfunction with the ingestion of marijuana and a frontal lobe dysfunction with the use of alcohol. So this is very interesting that even with the use of such drugs, that there could be an effect on the auditory skills.
Very interesting. And the next article, the next study that it talks about is a group of veterans that they studied on who were chronic alcoholics, and they found brainstem and central effect in this population. And the tests that were significant in identifying them were the SSW test, the synthetic sentence identification test, and the time compressed speech test. Those were the 3 that were able to detect this.
That's very interesting. The third study that was listed here related to such drug use was on a 12-year-old who had a history of seizures. And they showed this particular 12-year-old showed some SSW errors on the test when this child was not on a seizure medication. He had been, this child, I don't know whether it's a he or a she, the child was diagnosed with mild seizure. And after they were on seizure medication for a while, the SSW score again was administered, and they saw that the SSW scores had come down to the normal range, which again shows that drugs can have a significant effect on the brain, whether positive or negative.
Very interesting. And the next study is about the left competing ear scores.
Right. And the other study that we saw was on 15 children diagnosed with learning disability. This was a study by Jay Lucker in that article. And they all showed poorest scores in the left competing condition on SSW. The functional presenting difficulties were in spelling, language, reading problems, phonic, sound symbol association difficulties, emotional disturbance, sequencing difficulties. The left competing deficits could be related to the temporo-occipital and or the temporal parietal area of dysfunction, weakness, disorder, whatever you want to call it. And it was hypothesized that the type A pattern, where the left competing condition has the weakest score, could be related to the temporo-occipital lobe dysfunction, which is where the sound and symbol are associated. And in my clinic too, I see similar cases with type A pattern. They too present with significant reading difficulties. Their SSW scores do show left competing message deficit and left competing scores deficits. They, however, make consistent and great progress after intervention. The post-therapy scores on the test battery do improve significantly, and parents do report improvement in overall academic skills.
In my practice too, I have seen several kids with the type A pattern or the significant left competing scores having significant reading challenges who have done very well with reading intervention and auditory therapy.
That's the piece I think is missing in a lot of kids with specific learning disability, where the auditory weakness specifically is not being provided adequate intervention.
Yes. From all these studies, we can tell that SSW has great diagnostic significance, and it requires good clinical judgment and experience to be able to use this test as a diagnostic tool efficiently. And our viewers might be interested in further studying this particular area of the auditory impact by the alcohol and drugs, either recreational or prescription drugs. And if any of you have any information in this area, or you're perked to further study this area, please do so and share your information with us. We look forward to that. And please go to our website, igaps.org, and you will find this article and this recording under the resources.
See you again in the next recording. Hope you enjoy it.
Bye-bye.